pledge will be led by the gentlewoman from Texas, Miss Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time then for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Eddie Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Eddie Bernice Johnson.
Hello and welcome to the Capitol Report. I have a very interesting guest today. I know you've heard a lot of talk about health care reform. And, of course, I am very strongly for health care reform, which I have said very openly. And I'd like to ask her some questions. A practicing physician, Dr. Mandy Krauthamer, a primary care physician and executive director of Doctors for America. Doctors for America is a national organization of doctors who are working to reform health care so that it is affordable, accessible, high quality, and focused on the patient. In other words, we want to give the practice of medicine back to physicians and not to insurance companies. She was formerly the Deputy Director of Comprehensive Women's Health at the Department of Veterans Affairs here in Washington. She received her medical degree from Yale University and a master's in public health from Harvard University. She continues to practice medicine at the D.C. Veterans Administration Medical Center, where I spent 15 years in Dallas as a nurse. So I want to welcome you to the show, and I'm very eager to get into the discussion of what we're dealing with now. I have heard so much that is not true. I don't know whether it's misunderstanding of people or whether they've just decided to talk about it their own way, because it doesn't really touch facts. But tell me a little bit more about Doctors of America.
Well, first let me thank you for having me here on the program and for your leadership on this issue, which is clearly very important to the members of my organization, which are 15,000 physicians across the United States in all 50 states who support health reform, who know that it's time that our patients cannot wait any longer. The status quo is not acceptable anymore. Our system is broken, and we so much appreciate the steps that Congress has taken to reform the system. So Doctors for America, the organization that I'm a part of, works to bring the voice of the practicing physician that is so much in favor of this reform to the forefront. Make sure that doctors practicing in Texas, practicing in Oklahoma, practicing in Illinois can have their voice heard on this issue and say, we support reform, we know the system has to change now.
Give me your opinion of why healthcare is so inaccessible right now.
Yeah, there are many reasons. Yeah. Obviously, this is multifactorial, and that the system is very complicated. But one of the reasons people don't have access to care is clearly lack of insurance. So we know that there are patients out there for many reasons that don't have access to insurance. Many of them are working full-time and aren't able to buy insurance either because they work for themselves or their situation. So we know from research that those without insurance don't have access to care. And so that's one of the leading problems that this reform addresses, is making sure everyone has access to insurance, which will provide them to access to someone like me, a primary care doctor, and the rest of the medical world.
And this is something that just occurred to me to ask. Many of the members of Congress have been very opposed to a public option. The only reason why I'm supporting a public option is because the insurance companies will not insure many of the people that don't have health insurance. And we need some system where they can pay into that system so they can have access to health care. if there was any other way to do it, I'm waiting to hear what it is. Have you had any discussion on it?
Right. So we actually ask our physician members about the public option in particular. And so like I was saying, we as physicians we know the research that with insurance, people have better access to care and have better health outcomes. So doctors want our patients to have insurance coverage. And how those details get worked out, it is being worked out right now, but we asked our membership specifically about the public option, and as a physician, do you support a well-crafted public option for our patients? And overwhelmingly, over 90% of our physician members are in support of a public health insurance option. So it's very clear to us at Doctors for America that that's something that the physician community amongst Doctors for America supports. And I think overall in the physician community, again, doctors want patients to have insurance. And so, again, if there are other, options that are out there to make sure that those who are getting forced out of the private market have choices, great. I'm all for let's discuss all of those options. This is one way to do it. I think the President says it often, this is one way to provide all of our nation's citizens coverage. And as a physician, that's what I'm in favor of.
When people don't have access to purchasing insurance, it costs us a lot more. Because they'll go to the emergency room once they're sick. They've not had any instructions on how to avoid certain illnesses. And usually there's no history. And so it takes a lot more tests. And that costs end up going to the taxpayer and to persons who are paying for insurance.
Exactly.
So how do we arrive at patient-centered healthcare?
Right. So we know that there is a hidden tax in all of this on those of us who do have insurance and are lucky enough to be in a position to have insurance. But those who don't, while yes, you can walk into any emergency room and get care at any time, we're very lucky in that way. But it's not that the costs go accounted for in our system. So in order to make our system more patient-centered, and that's a buzzword that we hear in healthcare reform all the time, and there are different models of how to pay doctors in a different way in order to make it more patient-centered, really thinking about what does the patient need, what type of life do they have, are they working in a job that makes it really hard for them to come to appointments between 9 and 5, right? We all have jobs, it's really hard. Do they need morning hours in clinic? Do they need phone calls so they don't actually have to come in for a visit? Do they need to do email with their doctor in order to, avoid missing half a day of work in order to get care? Do they need just some education from a diabetic educator, for example? Maybe they don't need a full visit with me as the primary care doctor. We've talked about their medication regimen, but they actually need to learn how to use the insulin injection pump, for example. So we need to have a system that makes sense for patients. And I think there's a lot of elements in this reform that actually gets to making our system more friendly. So not just when it's an emergency, not just when you're already sick, not just so when you're already, knocking on the hospital door, but really making sure that you have coordinated care that makes sense for you as a patient, that allows you to not miss days of work if you don't need to, but make the system make sense. And that's what patient-centered is.
Yes.